Outstanding. Well, thank you to the three of you for joining us today. Now, before we start, a few housekeeping items. You can submit questions at any time for a panel to answer during the Q&A portion of today's chat. Questions can be submitted by commenting on this video, but please note that your name or profile name will be visible to others participating. If you prefer a more anonymous option, you can send a private message to us via the relevant social channel that you're viewing this on. And if you can't stay for the whole chat or want to share the recording with a friend, a video of the chat in its entirety will be available on our flagship Michigan Medicine YouTube channel. All right, so let's get started on our chat with our panel today, and we're going to start by discussing cannabis. First, what is cannabis and what forms does it come in? Which versions of those forms contain THC?
Sure. So cannabis as a term is taken on different meanings, but it really refers to a plant, and a particular type of the cannabis plant produces a lot of chemicals, many of which are known as cannabinoids. THC is one of those. That's tetrahydrocannabinol. That's the one that gets people high, and so it comes in various forms. A lot of, the traditional way is just taking parts of the plant, the buds mainly, and lighting them on fire and inhaling the contents. You get a lot of the cannabinoids that way. But people have come up with other ways. You can take some of the resins or the oily extracts that are secreted by the plant. Those are higher concentration of cannabinoids, especially the THC. So that's known as hash oil, or if it's dried out, it's hash. So that's a higher concentration. And then nowadays you can even distill that to get even higher concentrations of cannabinoids. That's usually in the form of a wax that people call dabs. That's the street name for that now. That's usually eaten. But any of these extracts you can also put into baked goods, cookies, brownies. You can put it into gummies. A lot of that's very popular now. The gummy bears or worms or gummy whatever, to deliver THC. And also now there's vaping, so you can instead of lighting it in a cigarette or something, you can vape these as well, to get the products. So pretty much all of them contain THC, and nowadays the way they've bred these plants and genetically engineered, they actually contain massive amounts of THC. There are some products that contain more cannabidiol. Most of them are going to contain THC as well. It is possible to get pure cannabidiol, but that may or may not match what's on the packaging. So
yeah, I'm glad you mentioned that, because I was going to ask, is CBD the same thing as marijuana?
Right. So CBD. So yeah. So that's cannabidiol. That's a different cannabinoid. It comes from the same plant, but has different properties. So it's not psychoactive in the sense that it doesn't get you high. And so people use it a little differently from the THC. It has different risks, so it's definitely different from the THC. Yeah.
Can CBD be used as medicine, and is it considered sort of safe compared to cannabis?
Yeah, so it doesn't have the same risks in terms of addiction risk, or there's some risk of psychosis and other types of disorders from THC. A lot of psychiatric problems from THC that you really don't have that same sort of risk from CBD. It has its own set of side effects. They're milder than THC, really, but it can be sedating. There's a lot we don't know about these compounds still, but it does seem to be, at least from most standpoints, it does seem to be safer than THC, which is not to say that it's completely safe and it doesn't have. I don't want to give that message that it has no potential side effects. It does, but it's definitely safer than THC for most of the applications. Using it as medicine, it is used as medicine. You can prescribe pure cannabidiol, and that is useful clearly for certain types of seizures. Lennox-Gastaut. There's some specific seizure disorders in babies that has been proven to work for. The problem, I think, with using cannabidiol as medicine is that it's mostly adults who are using this, and we really don't have evidence that it's good for anything in adults. A lot of the effects that people see from cannabidiol, when you study that scientifically, those are placebo effects. And so, it makes people feel good, so they like to use it. Part of that is because a lot of those products also contain THC, so they're actually getting high when they're using it. So, and the other thing is a lot of the products that are out there, they don't contain as much cannabidiol. I mean, most of them do. It's like, I think about a quarter of them don't contain as much cannabidiol as they're claiming. They sometimes have contaminants in them, like heavy metals or pesticides. It's not really regulated by the FDA, so you don't know exactly what you're getting in these. And a lot of them also contain THC, even though they say they don't. They also contain THC. So, if you get it as a prescription, yes, that is a medicine. If you buy it in a store, it's not exactly a medicine in those forms.
Mm-hmm. Now, I know cannabis and marijuana affects different people in different ways. What sort of determines how marijuana and cannabis will affect someone and how they'll react to it?
So I can address that again. Cannabis, a lot of the variation in how people respond to this comes down to genetics, and a lot of these genetics we don't understand fully. We can't point to like specific genes that will set you up for responding to cannabis in a certain way. But it's clearly heritable. It runs in families. You can see a genetic component to it. And so that's going to determine to a large extent people's risk of addiction, risk of psychosis, things like this from cannabinoids. There are some environmental factors that can affect that as well. Things like early life trauma or something like that. That will affect people's risk for addiction in general. And so that's going to apply to marijuana as well. But there are differences. There are actually fairly wide differences in the amount of cannabinoid receptors that you have in your body. So that's the type of thing that can affect how somebody responds to cannabis. I guess I can also mention people get tolerant to cannabinoids fairly quickly. So your history of using cannabis is going to have a very large effect on your response to it.
Yeah. So as an addiction expert, how would you say someone would know whether they've become addicted to cannabis, and how much is too much for somebody?
So addiction is a psychiatric disorder. It has different criteria, but what it boils down to is it interfering with your life? Are you functioning better or worse with this substance on board? So when someone is addicted to cannabis or anything else, they're going to be spending a lot of time using, a lot of their time finding the substance, recovering from the substance. It's going to interfere with things like work, family. You'll get into conflicts with people over the use, and you're going to be impaired just in your normal functioning. If you see that, if other people see that, and yet you continue to use, that's a sign of an addiction at that point. An addiction to cannabis, it's less addictive in the sense that less of people who use cannabis become addicted to it than things like heroin or something like that. But if you actually develop an addiction to cannabis, it can be very severe. It can be as severe as anything else. I've seen people's whole lives fall apart because of cannabis. So it's definitely something that you could get treatment for, and should seek treatment for it if it's becoming a problem, because it really can have a major impact on both the person and everyone else in that person's life.
Dr. Brandt, let's turn to you. How does marijuana affect my health or a user's health, and specifically heart health?
Yeah, that's a great question, and I can comment on this. Like Dr. Morrow was saying, is that there are these cannabinoid receptors throughout the body and different organs, and there happen to be these types of receptors in the heart and also throughout our body and our blood vessels. So they've been able to measure that cannabis intake, and really in whatever form, can activate these receptors, and they actually end up having some potential negative effects physiologically. And especially thinking within the prevention space, the the ways that they've been able to measure these physiologic changes align with other types of things that we know impact negative heart health. So some of those things is that they cause constriction of your blood vessels. They increase the actual what I call the sympathetic nervous system related hormones, which increase stress on the body. It's also a pro-inflammatory. Some of that maybe be more likely if you're using marijuana in the combustible forms. Like Dr. Morrow was mentioning, there's many different forms or ways that you can ingest cannabis. And ultimately, there have been some studies to try to then link these types of physiologic changes that can be measured after using marijuana to actual cardiovascular outcomes. And in those studies, there have been some really unique ways they've looked at this. But if you look at broad populations, marijuana use in general is associated with different types of heart problems. And in states where there's been legalization compared to states without, there's been a shift with increased risk for things like heart attack.
So let's talk about marijuana versus cigarettes. Which would you say is worse for heart health? And do they both put people at risk for heart disease?
So your last part of your question first, yes, they do both put people at risk for heart disease. I think it's hard for me to give a complete comparison of which one is worse than the other. We certainly have a much larger database and knowledge base for understanding the impact of nicotine products, especially cigarettes, on heart health, going back several decades and even half of a century now. Some of the limitation for understanding that marijuana's impact is that traditionally it's been illegal and difficult to study for that reason as a controlled substance. I think that as states have moved towards legalization, and then whether or not the federal government decides to change the scheduling of the drug and move towards legalization, that could potentially change our understanding and having a better comparison between the two. But I can certainly say that both of them are harmful, given some of the shared mechanisms that I had said in the previous question that you had asked.
So let's bring a third option into the mix. What about vaping, and how does that compare to cigarettes for heart health?
Yeah, so vaping, I would say, is probably healthier than using the combustible forms of either nicotine products or cannabis. Vaping, initially there was some potential benefits discussed where maybe vaping could be a way to move from combustible products, which we know are extremely harmful, towards quitting and cessation. I don't want to say, though, that vaping is a completely safe option. So certainly it's still worse than if you weren't using any type of nicotine or cannabis products at all. Just for example, just nicotine ingestion in general leads to activation of our red blood cell, or our cell types that cause clotting. So no matter what way you ingest it, it can increase that risk, which, as those cells called platelets aggregate, they can lead to potentially things like heart attack or a stroke.
Great.
Can I also add there that vaping, those products are also not regulated well by the FDA at all. So a lot of them are contaminated again with heavy metals, asbestos. I mean, things that we know are very harmful for people. It's not going to be as bad as what's in cigarettes. Like nothing's as bad as that. But you can definitely get some major problem from the stuff that's in the vape product.
I
They're
think
also
the classic story there is what's called popcorn lung, which was first seen in popcorn factory workers, but then a similar compound that I can't recall the name of, was also previously in some of these vape pods and causing this popcorn lung syndrome in vape users that I think was really discussed on a lot of news outlets.
Yeah, and the promise of it helping with addiction, it may be actually helpful for people who are addicted to cigarettes to transition off. That may be the case, but the way these products have actually hit the market, they've actually ramped them up to enhance addiction, to make them as addictive as possible. So the net effect is really it gets kids hooked on these products who have never smoked before. Now they're using these flavored products, so it actually ends up leading to more addiction than anything else. But
yeah, and to add on to, I believe there's also some concern that, like you were saying, that then individuals will move from vape products to the combustible products, which we were initially trying to move away from.
All right, well, Dr. Colvin, you've been very patient, so I'm going to start with you with this next question. Does using marijuana affect heart medications if somebody is on them?
So the short answer, yes, there's a potential for drug interactions. And I just want to preface that by saying, first of all, it's important to make your doctor aware of any substance that's not prescribed that you're using or taking, whether it's an over-the-counter herbal medication or marijuana or alcohol. It's important to make your doctor aware, because important drug interactions can occur that can decrease or increase the effectiveness or increase levels of certain medications that you are taking. So in the case of marijuana, some compounds that are found in marijuana are using the same pathways, particularly when ingested, are using the same pathways to be metabolized as other common heart medications, such as commonly used medication, a blood thinner, warfarin or Coumadin, anti-cholesterol medicines such as statins, and some blood pressure medicines. So, for example, if you're taking warfarin, marijuana can interact with warfarin and lead to high levels of this blood thinner and lead to excessive bleeding. So it really is important that when you are in heart medicines or any type of medications, that you make your doctor aware of your marijuana use and any other type of drug or substance that you're using as well.
So we've talked a lot about some of the negative effects that marijuana and cannabis use could have. I know that a lot of people are using it for pain or anxiety to help alleviate those effects. How do the benefits of that sort of stack up with the cons of these other health consequences?
Yeah, so I can speak to that a little bit. So cannabis, it definitely will, well, for most people, it will reduce anxiety in the short term. Some people actually get more anxious when they take, that's basically because they get paranoid. But it can reduce anxiety acutely. The problem with that is, again, people get tolerant to it very quickly. And so it happens, within a week or two, it can happen where people, they get a rebound effect of anxiety. So they get withdrawal from the cannabis when it's not there. And one of the symptoms of withdrawal is insomnia, anxiety. And so then they start using the cannabis unintentionally, but they start using the cannabis to treat their cannabis withdrawal. And that's a never-ending cycle. So the anxiety is actually increasing, the insomnia is actually increasing along with the cannabis use. So that's kind of a danger of using it for anxiety like that. We have other treatments for anxiety that don't have any of those problems. There's therapy, there's standard psychiatric medications that don't have those problems of tolerance and addiction. Pain, it could also be useful for pain. It definitely has analgesic properties. It's not great for pain. In head-to-head comparisons, if we're just talking about pain, Tylenol works better than marijuana. Ibuprofen works better. People might not feel as good because they're not getting high off of it, but it works better for the pain actually. Where it can be useful, there's newer research where it can be useful for people who are chronically on opioids. Opioids, usually you don't, I mean, almost never does somebody have to be on chronic opioids, but if they are and they use cannabis, it will lower their requirement for opioids. It seems to work together pretty well with opioids. And cannabis has a lot less problems than opioids. So on net, that can be a good use of cannabis to reduce the opioid use. Generally speaking, though, whatever medical benefits that cannabis can give, there's something better that doesn't have as many side effects. I mean, we can prescribe THC. It's on formulary. We don't do it because it doesn't work for most of it. There's better options available. That again, they won't make you high, but they work better for the actual thing that you're trying to treat.
Yeah, that's great insight. All right, so I'd like to hear sort of a personal perspective from our cardiologist, Dr. Colvin and Dr. Brandt. Do your patients often ask you about cannabis use when you're caring for them, and what do you typically tell them if they do?
Well, I can start with that. Some patients will tell us, some patients won't. We're frequently, at least I'm frequently asked, can I use it? Is it going to make my heart better? That sort of thing. And in general, it's similar to the recommendation with alcohol. There really is no evidence that it's beneficial for cardiac function. And there's quite a bit of evidence that it can cause some cardiovascular side effects. I think, and if I consider my transplant space where there's significant interaction with some of the anti-rejection medication, it's really important that I'm aware of what they're taking and how they're using it. So I generally would advise against it or in moderation, and certainly do not tout any sort of benefit or any type of beneficial effect with it.
Yeah, I agree with what Dr. Colvin said. I think that the legalization process in Michigan has made it so there's less of a pressure to hide it from clinicians. And individuals do ask about whether or not they should use it. And I know we're going to move on to discuss alcohol eventually, but generally what I talk about maybe with both the spaces is that I don't promote its use necessarily, and try if you're going to use it, then try to use the least harmful forms. So in this case, moving away from combustible products towards other non-combustible options. But otherwise, I agree with what Dr. Colvin had said.
All right, so let's stick with you, Dr. Brandt, for one more question. Can cannabis cause AFib or heart rhythm disorders?
It's similar to what I was discussing before, where marijuana can activate that sympathetic or like the fight or flight part of our nervous system and those hormones. Those hormones are also known to potentially instigate these types of abnormal heart rhythms. So it shares that with alcohol too, that it can potentially cause AFib and some other abnormal heart rhythms, like even just plain old extra heartbeats.
Excellent. Well, and that's a perfect transition because you mentioned that we are going to talk about alcohol on this live stream as well. So let's transition a little bit from cannabis into alcohol. And what would you say, and I can open this up to the whole panel or whoever wants to answer it, what are the guidelines and how much alcohol use is okay or quote unquote okay, and how much you would consider is too much?
Sure, I can start. So there are I'll preface this by saying they're kind of old guidelines, but there are some guidelines on specific like amounts of alcohol. And it's for men, it's 14, no more than 14 drinks a week. For women, no more than 7 drinks a week. And it's no more than 1 drink a day for women and no more than 2 a day for men. And there's a defined binge drinking episode would be 5 drinks in one day for a man, or 4 drinks in one day for a woman. And those are standard drinks, which is smaller than people think. It's a 12-ounce beer. It's a 5-ounce glass of wine. It's a 1.5-ounce glass of liquor. So that was developed, like I said, a while ago, before we had evidence that really any level of alcohol is going to cause some problems for you. So we used to think it was more complicated than this, but more recent evidence shows that it's really pretty simple. The more alcohol you drink, the more problems you're going to have. And so it's the less you drink, the better, and you'll be the best off if you like from just a health perspective. You're the best off if you're not drinking at all. Doesn't mean that you are going to choose to do that, but that's what from a health perspective, that's the best thing. And how much is too much? I mean, from an addiction perspective, those guidelines are actually pretty decent. If you're drinking more than that, you're at much higher risk for developing an addiction to it. But like I say, from a physical health standpoint, it's a poison. It's just not good for you.
So I'll agree with Dr. Morrow. Some people may recall that there was a study published last year, and I think it was a World Health Federation saying that no amount of alcohol is safe, no amount is good. And I'm frequently asked, how much alcohol should I drink? How much is going to be good for my heart? And I think it's true. We don't really know whether there's an amount that's actually good for your heart. Probably there's no amount that's good for your heart, but there are amounts that are less bad for your heart, so to speak. And the less, the better. And so there was, I'm a heart failure doctor. So there was a study that showed that if you drank 7 drinks per week or less, your risk of heart failure was going to be less, right? But, what the AHA has kind of put in their recommendations as safe is what Dr. Morris already mentioned: 1 drink a day for women, 1 to 2 for men. So, I think, and then binging, I guess if you're drinking 8 or more per day, that's clearly harmful. So the more you drink, the more at risk you're going to be, the less, the better. And, in my world, less than 7 drinks per week is probably better. If you drink. I think the conclusion from that paper was that there's no reason to drink alcohol for cardiovascular benefit. If you're not drinking, there's no need to start. But if you are drinking, do it in moderation.
Perfect. Now, Dr. Morrow, how can I tell whether I have an alcohol use disorder problem? And if I do, what should I do about it?
Yeah, so like I said, those guidelines are actually pretty useful in terms of alcohol. If you're drinking more than that, I would at least think about whether this is a problem in your life. Are you able to try stopping or reducing your use and see what happens? People do the dry January type thing. That can be a good guide for you. Are you able to do that? Do you start out the month saying I'm not going to drink, and then halfway through say, well, I'm actually drinking? What happened there? That could be a sign that you actually don't have as much control over this as you may thought. And like I said, for marijuana, you're going to look for, is this interfering in other aspects of my life, my job, my marriage, my hobbies, all these types of things? Am I still doing these things? Am I replacing that with alcohol? Is it having physical problems? And if it is, if my doctor has told me that I'm having physical problems from my drinking, am I still drinking? Why? It's probably, you got to question whether that's addiction. And if it is, seek help. I work at the Addiction Treatment Center at U of M. There's other places like that. Get a consultation. We can talk with you about it and figure out what the next step should be.
In what ways does alcohol use affect heart health? I know that we know it does affect it, but in what ways is it really impacting it?
Yeah, and I can start off here. And I know Dr. Copeland already mentioned some of the things that we have looked at, associations with alcohol and cardiac outcomes. kind of like I talked about marijuana, I'll talk about the physiologic effects. And the one of the things that's been looked at is how it affects our arteries and our veins. Um, and maybe I'm more keen on this because of my focus on prevention. But I think about it in the context of hypertension, and during alcohol use and the short period after it relaxes your arteries and veins where blood pressure may go down, but then there's a compensatory response where it actually leads to more hypertension further on past the alcohol use episodes. So, and that's one of the contexts that I see it in, is that it does maybe disrupt that part of our physiology and cause shifts there. And I'll piggyback on what Dr. Colvin had said about how we look at it and what it associates with cardiovascular outcomes. And how we've thought about this has certainly shifted over time, and it certainly differs depending on the cardiac condition that you're talking about. When I think about its risk for things like heart attack, there seems to probably be a benefit at low to moderate use, as already described by Dr. Morrow and Dr. Colvin. But that associated risk can quickly start to go up if you're using more than that. And that observation isn't seen for all conditions. So, for example, for stroke, there doesn't seem to be that benefit at all, where there may be only associated increased risk. And then thinking about AFib and individuals that have had prior AFib events and recurrent AFib events, there's not a known safe use of alcohol. Any amount of use is going to increase your risk of recurrence. So it is disease specific, but in general, I'll stand by the American Heart Association, and I completely agree with them that if you're not using, no reason to start using alcohol, and then otherwise try to really fit within these guidelines, because there is some clear harm that can be had from them.
And what about cholesterol levels and cholesterol related health issues? How does alcohol affect those?
Yeah, great question. This is my soapbox. So this is like my you're teeing me up here. So with alcohol, it does known to associate with shifts in our lipid profile. The most common one that I think individuals know in the broad population are impacts on HDL, which is commonly known as the good cholesterol, where it may increase your HDL cholesterol a few points. What I'll say on that, though, is that actually our thinking about HDL cholesterol in the field of lipidology has changed over time, and we no longer consider it the quote unquote good cholesterol. It in and of itself, it does not protect us. What HDL is doing is responding to the metabolic environment that we place it. So it can go down or up related to different metabolic states, but it doesn't necessarily cardioprotect us. And actually it may cause harm, especially when individuals have very high levels above 100, especially more often among men. So I think leaning on the good cholesterol effect of alcohol is not a scientifically sound way to think about it anymore. Now, alcohol does also shift some of the other things that we measure within cholesterol panels. It does decrease our bad cholesterols a little bit, the LDL cholesterols as we know them. That shift is actually relatively small, just a few points. So probably not enough to make an individual impact. Maybe on a population level, a small impact, but not on, and maybe that's where we see the benefit in that slight decreased risk for heart attacks in some of those studies that I mentioned before. The one area that I see it more contributing more often, because I see more or less common cases of extremely high triglyceride levels, is that as alcohol use increases, it can shift liver's metabolism of the lipid molecules that contain triglycerides or fats, which can cause very high levels, and then together with high alcohol use and high triglycerides can lead to a condition called pancreatitis, which can then lead to diabetes and other consequences. But I think that covers it for all the lipid stuff.
Excellent. All right. So we may have touched on this a little bit already, because we talked about how, any alcohol use might be worse than no alcohol use. But let's go to that other extreme where it comes to binge drinking. What type of impact does that have on heart health? And I would assume, and maybe I'm wrong, that it has a much bigger impact on heart health than regular use of alcohol. Is that correct? Obviously, I'd like to hear from our experts on that one.
Yeah, I'll comment on this first, and if anyone has any other comments, I'll welcome them. But in the setting of binge drinking, the first thing that comes to my mind are abnormal heart rhythms, and thus just direct toxicity to the cardiac tissue, which could potentially even lead to cardiac arrest. But one of the common things we see is so-called holiday heart, common around the holidays, where there's heavy alcohol use and increased risk for abnormal heart rhythms like atrial fibrillation.
What would you say is, so we know sort of some of the short-term impacts that you might have from alcohol use. What are some of the more long-term impacts that you'll see?
Yeah, I think besides ones that I mentioned before, I think we're thinking about the risk of different conditions. And I know, Dr. Colvin might have more to say about this, but the long-term impacts that we sometimes will see are related to long-term negative consequences on cardiac function. And I can let her delve into that a little bit more. But I think the long-term impact goes back to thinking about the potential we thought maybe that it had for helping with prevention of disease that doesn't seem to be as strong as maybe we had thought 20 years ago before we had more robust data like we do now.
And to add to that, chronic use of alcohol and heavy alcohol use can certainly increase risk factors for developing heart failure. They increase certain types of cardiovascular disease, high blood pressure, et cetera, but can also be directly toxic to the heart and lead to heart failure, which I know we're going to talk a little bit more about. It can result in something called alcoholic cardiomyopathy.
Yeah, I think that's a good thing that you brought that up. I wanted to go into a couple more questions about specific instances here. So can alcohol intoxication cause cardiac arrest? I know a lot of people are interested in learning about that.
Right. So I guess, how do we define alcohol intoxication? I think it's legally defined as a blood alcohol level of 0.8%. But what does that mean? And whenever you have very high blood alcohol concentration levels, this can lead to, some potential side effects, heart arrhythmias, for instance. So atrial fibrillation we've talked about. But another type of arrhythmia that can occur is VTAC, or ventricular fibrillation, ventricular tachycardia. Both of those are less common, but serious types of arrhythmias that can lead to cardiac arrest. In addition to that, very high levels of alcohol, toxic levels, can not only shut down your heart function, but shuts down the whole body. It shuts down your brain function, which regulates your heart rate as well. So that can also lead to cardiac arrest.
And I know you just brought this up a minute ago as a possible effect of alcohol consumption. So what is alcoholic cardiomyopathy, and how do I know if I'm at risk?
Okay, well, cardiomyopathy is basically a weakening of the heart muscle. It's a type of heart disease that can lead to heart failure. So alcoholic cardiomyopathy is the result of long-term and heavy alcohol ingestion. And as has been mentioned, alcohol can have a directly toxic effect on the myocardium, and that causes the heart muscle to become weak over time. So what does that mean? What that means is people who develop cardiomyopathy are at very high risk of going on to developing heart failure symptoms. Heart failure meaning the syndrome of having swelling, shortness of breath, poor exercise capacity. This can also lead to tachycardias, ventricular tachycardias, and other types of health problems. So and what we do know is this can be treatable at certain points. It can be reversible at certain points. And if you've been diagnosed with alcoholic cardiomyopathy, it's recommended that you completely abstain from alcohol use. And in some cases, this can get better. Binge drinking, we've mentioned, has been associated with it, and I mentioned that 8 drinks a day for several years may increase the risk. But again, we're not completely sure how much alcohol is going to be bad. and it will cause heart failure. Could smaller amounts cause heart failure? That we don't know.
All right, so we asked this question about cannabis, and I want to open it up and maybe to all three of you, because Dr. Morrow, you could talk about those maybe who have alcohol use disorder as well. But how do you talk to your patients about alcohol, especially if they're potentially dealing with an alcohol use disorder or the effects of it?
Well, I guess I can start with that. It's probably a little bit different for me because most of the patients I see are coming there already because of a substance use problem. So they have someone in their life has recognized at least that they've had a substance use issue or potentially. So the way I'll explore that is just trying to take a little bit of an inventory of how much they're using, in what settings, and then the most important thing is what effect is that having on your life? What are you trying to get out of this? Is it having that effect? What other effects is it having? And just kind of weighing pros and cons of this pattern of use and this role that is playing in your life. Because a lot of what happens with, when people have an addiction, that's fundamentally, it's a loss of control over the use. They don't want to be using as much as they're using. And sometimes people will try to fool themselves about what their actually motives are. But if you really explore, like, do you want to be using this much given all of these things that are happening in your life? The answer is really no. And then we can help you with getting more control over that use and getting your use to a level that actually makes sense for you. So anyway, that's a general approach of how I would start that conversation.
Yeah, and then I was going to ask our cardiologist, how do you talk to your patients about alcohol use?
I'm going to let Dr. Brandt go first because there's like an interesting progression here from prevention to actually dealing with patients with severe disease.
Yeah, so when this comes up in clinic, which it's always included in most scenarios, is what I'll assess how often they're using, and then I'll go back to what we know as really good recommendations from the American Heart Association. And then sometimes folks will ask the question if they should use it, and then I'll say no, not unless you have another reason to. There's no health reason to. And then kind of connecting back to what Dr. Morrow's work does, if their use level enters into an area that might be a problem, then there are screeners available for clinicians to use to see if it might be a problem, and then we can refer them to appropriate resources within the University of Michigan's network. So I'll focus on going back to those previous recommendations, which are trying to cap out per week use in women at 7 alcoholic beverages and men at 14 beverages, but not more than 1 a day for women and 2 a day for men.
So by the time patients get to me, they have established heart disease. And so we're dealing with the end result. And not infrequently, we're seeing patients who have the end result of alcohol use. So at that point, it's very difficult to say, well, it's okay to drink 1 or 2 drinks per day because now there's established disease. The majority of the time, we are recommending abstinence in our patients who have heart failure. In our patients who have more severe heart failure, let's go beyond that, those who are going to need transplant heart failure, if someone is actively using alcohol or marijuana, particularly if they have a substance use disorder, they would not qualify for some of these therapies. So abstinence becomes extremely important in those who are going to require more than medical therapy. But for those patients who don't require transplant, routine heart failure, it's really important to abstain from alcohol, as that may negate some of the effects of the medications and the potential to recover from heart failure. So our conversation tends to be very different.
Absolutely. That's very interesting insight. And Dr. Morrow, I know you have something to add to that. Yeah.
Yeah, I just wanted to add, because I feel like this message may not have come through in some of the comments that we've made before, but So I don't view alcohol use or cannabis use as necessarily a problem. That's not something that has to be treated in and of itself. It's the effect that it has on somebody's life. That's what I'm looking for. If it's really having a negative impact, then maybe we need to intervene, because there's other things that, like eating a Big Mac is not good for you either. Watching TV is not good for you either. But if I hear that you're doing that, that doesn't mean we need a medical intervention here. If you're doing it so much that it's clearly having an impact, or if you have, if you have bad diabetes or something, like you can't eat ice cream. I mean, it's just not, it's not something that you can do anymore. So, so it depends on the totality of the person's life and what effect that's having on it, whether this is really something that merits an intervention or not.
Yeah, I appreciate your clarifying that, because that becomes a gray area for us in heart transplant advanced therapies in determining whether there's a disorder or not. And so we heavily rely on our mental health experts, our psychiatrists, our social workers, psychologists, et cetera. And those patients who are identified as having substance use disorders are then referred on for assistance. So great.
Yeah, I love that. I think that's great clarification. Now, before we wrap up today, I would like to go around the panel and just ask if you have anything else that you'd like to add, or if you have any key takeaways that you'd like to leave with our viewing audience today. So Dr. Morrow, let's start with you.
Well, I guess I kind of gave my take one of the one of the takeaways, but I would say if you or someone seems to have an issue with alcohol, cannabis, or other substances that we didn't talk about, there are resources available. People do get better. I see that all the time. That's one of the most gratifying things in my work. I see people who are very ill at death's door, and when we can get their substance use under control, it totally turns them around. Just stop putting the poison in your body, and it just gets a lot better. So it can happen. Seek out help. It's not that hard to get an appointment with us. So I would encourage you to do that.
All right, and I can go next for my kind of final statement. I guess what I would say is sort of in line with what was most recently being discussed, is that it's important to share your use with your clinical care team so that they know how it might interact with the conditions that they're managing. And from a prevention standpoint, which is my focus, that if you are using, try to just choose the least harmful routes for use of either cannabis or frequency of alcohol. And if you're not using, then there's no specific benefit, so there's no reason to to figure out how to.
Well, I was going to say exactly what Dr. Brandt just said, but I'll just reiterate what he said. Number one, if you're not using, don't start. If you are, always in moderation. And finally, just share, be transparent with your care team.
I'm glad we're all on the same page here. Thank you so much for your insight. And thank you to our viewing audience for joining us today. And of course, our panelists for a great discussion on cannabis, alcohol, and cardiovascular health. If you missed any parts of today's live stream, we will have it posted on our Michigan Medicine social channels. Thank you so much for joining us, and have a wonderful day.